The first day of the year, we recorded the first death of the year, and the Myrtle Rigby Health Complex came under fire from residents. Angie Toussaint was at a midday press conference. Here's more.
From medical officials is that Leslie Orellis suffered a terrible fate after a weapon he had been stabbed with punctured his cardiopulmonary arteries, or in layman's terms, his heart. There were many rumors surrounding the death of the 17-year-old on the morning of Tuesday, January 1st, and many questions that had to be answered. Director of Medical Services, Dr. Rufus Ewing, comments during a press conference.
At the time when he arrived in the emergency room, he had no vital signs. Cardiopulmonary resuscitation was in progress by the fire persons who brought him to the emergency room at the hospital. The CPR was continued in the emergency room. It was determined that because of the nature of the injury, more than likely he would have had an injury to the heart. And because of that, an emergency room thoracotomy, or opening of the chest wall in the emergency room, is a life-saving procedure to remove the blood from around the heart and to try to repair the wound temporarily to allow the heart to receive blood and expand and to at least give him a chance of survival. However, he succumbed to the injury, which was basically a penetrating wound directly to the left side of the heart, with what you call a cardiac tamponade. That means blood collecting around the heart and also in the chest cavity. And he was pronounced dead at about around 7:39 a.m. on that morning.
Medical officials are being scrutinized by people in the community because of their seeming lack of response during the incident. Many say that Orellis' death could have been prevented. Dr. Ewing contradicts the theory.
Yes, it was a penetrating wound from the chest wall and in the front, straight through to the front wall of the heart. And those type of wounds sometimes are directly fatal. And even if you bring them to the emergency room and you manage to keep them alive for a few, sometimes the majority of them succumb to their wounds.
In defense as to why paramedics were not on site when the incident occurred, Dr. Ewing said that there were many contributing factors, including 2 major traffic accidents on the morning of New Year's, a stabbing at Junkanoo before the Orellis incident, and other emergencies, which required paramedic assistance.
We're not quite certain as to what time the call to the ambulance came in. The indications suggest that it might have come in from the police department at around 6:30 or 5:30, 6:30 or so, 6:30 in the morning from the police department, and the ambulance was dispatched at around 5:50 a.m. But around 5:52, the fire truck, which were on site at the Junkanoo event, brought the person in. Actually, the fire truck left the scene at around 5:45 a.m. from the downtown area. In the fire personnel.
The family of Leslie Orellis have also asked questions about their son's operations before his death. Dr. Ewing said the procedure was a life-saving one, necessary in cases of trauma or emergency.
No, in a traumatic situation like that, life or death situation where you are actually in the active process of resuscitation, there's a split-minute decision to decide to do an emergency room thoracotomy. It's a life-saving procedure, and the decision usually does not rest with a particular family member at that particular point in time as to whether or not you're going to let him live or die. Someone who has a traumatic injury to a heart.
The Director of Medical Services admitted that presently there is no established protocol. The police are usually contacted first, sometimes the fire department, and almost all the time the paramedics are the last ones notified. Dr. Ewing said his department, in collaboration with the police, is establishing a calling center so that there can be better handling all around. It was also said organizers of large events should always have a medical team on standby. For WIV4, I'm Angie Toussaint.